Hi, welcome to Dr. Gao's classroom. Today, I get a special guest, Dr. Rey Tiquia. He is an excellent traditional Chinese medical practitioner. He studied in the best traditional Chinese medical university in Beijing. He has been practicing traditional Chinese medicine for many, many years. He also published research papers and books in traditional Chinese medicine. So today, I'm going to ask a lot of questions about the theories and practice of traditional Chinese medicine. What I hope to achieve today is to help you to have a better understanding of the theory and practice so that you would get more out of your consultation with a traditional Chinese practitioner. Or you could take better care of yourself, informed by the theory and practice and experience of Dr. Rey Tiquia. Okay, Dr. Rey, can you tell me how many years have you been practicing traditional Chinese medicine?
Um, Thanks for your kind introduction, Professor Gao Yin. Well, I have been practicing traditional Chinese medicine in Melbourne for the past 40 years.
Wow, wow. Um, how many patients do you see in your business time, like per day?
Um, Look, it varies. Today, we are just coming out of the COVID pandemic
Yes.
here in Melbourne. And during 3 years in interregnum of the COVID pandemic, you know, I was open, but most of my patients were not coming. They
Oh,
were they were all confused about what was happening at the time, and it was only recently that I have been receiving calls from my old patients.
yes.
So to put it more in brief, I see patients probably around 4, 5, 10 patients in a week.
Oh, right, right,
Yeah,
right.
and also at the moment I am in a state of partial retirement.
Ah, yes, yes. So you actually have more time for each patient.
Yes, but having more time with each patient is an added sort of way that I have been seeing patients for the past years in Melbourne even before the pandemic.
Mm.
Generally, I spend probably 30 to 45 minutes in
Wow,
seeing a patient
wow.
because um, you have to assess the condition of the patients, make a diagnosis of the condition based on traditional Chinese medicine, and then work out what sort of treatment that
Yes,
you can give to a particular patient
yes,
based on that diagnosis.
yes. So what do you look at when you see a patient? Like what kind of sign and information you'll be gathering, like a kind of question you ask to your patient?
That's a very good question, Professor Gao. In Chinese medicine, before we make a diagnosis, we we have to um, deploy a system of examining the patient, which in Chinese is called Suzhen,
Oh, yes.
or which is actually Wang Wen Qie,
Oh,
which
yes,
actually means you have to observe the patient, which is Wang. You have to deploy some questions, uh, give some questions to the patient to understand the history of the condition. That's the when, and then the when you have to use your olfactory sense and
yes.
to work
Yes.
out um, the smell of the atmosphere and that sort of thing.
Oh, yes. Can I interrupt? See, this one is very important because it means both listening in and smelling.
Smelling, yes.
So you will be like closely listening to how the patients talk
Yes,
and his voice,
yes.
and sometimes smell a bit of body odor.
Not only that,
No.
not only the body odor. You see, sometimes if a patient comes with the gunmouth or
Oh yes, like a
upper
cold. Yes,
respiratory tract
yes.
infection, you can actually smell some
Like a
the smell of
bread.
the mucus and the breath or something like that.
Oh.
So you would know whether the patient is having a, a a heat condition or a cold condition.
Oh. Oh.
So the realm of wending or smelling
Yes.
is really very wide.
Wow.
And then
Wow.
the last one is the che.
Yes.
Che is to, well, the English translation is to palpate, but basically it is to feel the pulse
Yes.
and then also
Oh,
to
to
touch
touch the
some
bodies
body
part.
surfaces where the flow of the chi runs along the meridians of the body on the surface of the body.
Oh,
So
right.
touching is very important
Yes.
because you get in touch with the chi, with the life force of a particular
I would
patient.
ask certainly more question about the qi. So the next question actually was closely related to this is that if someone just show up in your clinic, they know absolutely nothing about Chinese medicine or all this theory or whatever. They just heard from a friend. Oh, so and so very good. You did this for me and it was good. So they come up to your clinic. How do you explain what you're going to do? Like, the Wang Wen Qie, as well as, the symptoms that you're going to ask.
Yeah, that was a difficult problem for me
Yes.
40 years ago when I started practicing in Melbourne.
Yes.
Because here in Australia, most people are only aware of Western medicine.
Yes.
See,
Yes.
so when they come to see me at that time, um, they would ask me, they would try to know, they will tell me what they're suffering from in terms of the diagnosis of a Western medical practitioner.
Yes.
So they will say that, well, I have hypertension,
Mm.
I have sciatica, and
Mm.
that sort of thing. So at the time, it was difficult because I had to translate in my mind exactly what those conditions are in terms of the language of traditional Chinese medicine.
Mm.
Like the case of sciatic nerve problem. Now I can see that if a patient complains of some pain on the hips, on the back, that runs through the side of the
Oh, yes.
body,
Yes. Yes.
well, I would know when I would know if I ask some questions about the where the patient is suffering from the pain, whether it affects the gallbladder meridian
Yes.
or the spleen meridian, which runs along the lower
Oh.
extremity.
Yes, this is the gallbladder and kidney meridian is going this side. This is,
Well, the gallbladder is on the side of the
yes.
leg,
Yes.
and the kidney meridian and the urinary bladder meridian runs
Yes.
on the back of the leg.
Oh, so you will ask specific
Yes,
positions where the pain kind of
yes.
goes along.
The same
Oh,
is true with hypertension.
yes.
With high blood pressure, when patient comes, they tell me that who suffers from high blood pressure. All right, he said, I have this headache, and so I asked, where is the headache?
Yes.
They would say, well, it's on the side of the head.
Yes.
Some people say it's on the top of the head.
Yes.
Some people say it's on
The
the
back.
back
Yes.
of the head. So based on that description made by the patient on where the headache is, I would have some idea of what particular meridian is actually where the flow of the chi is actually affected.
Oh, so what you're doing is by asking the question, by specifying the spatial locations and how the sort of the location was sort of the pain or whatever complaint sort of happening, how it happens, you were able to identify which meridian was affected.
Affected, yes.
And so, how do you explain this to your patients? They would say, "What is meridian? Why do you asking all these weird questions?"
So, well, so I use um, both the language of Western medicine
Yes,
and Chinese medicine to explain it.
yes.
Because there are some patients who say that um, when I tell them that you are having some problem with your gallbladder meridian, they will say, "But Ray, I don't have any gallbladder anymore."
Yeah, it's removed or had a surgery, removed it.
So,
Yeah, yeah.
so that's so I explain back. Look, in Chinese medicine, when we look at the internal organs,
Hmm.
we look at it in the same way as a Western doctor looks at it. They are actually real organs. But in Chinese medicine, the inner organs also have, they emit a type of energy
Ah, yes,
called qi.
yes.
And this emission of this energy, if it emits, if it flows harmoniously in all those meridians, then the patient will be well. But if they are
Oh.
deranged or they become blocked, the flow of the qi in these meridians from the internal organs, then symptoms can arise.
So how do you resolve the question that if that specific organ is absent, but the meridian is still there, right?
Well, this is the big difference
Yes,
in
yes,
the philosophical outlook of Western
yes,
and Chinese
yes,
medicine.
yes,
In
yes,
Western medicine, there is, because of the influence of Descartes,
yes,
uh, most biomedical practitioners, they see a separation between the mind and the body,
yes,
or the Xin
yes,
and the Ti,
yes,
or something like
yes,
that.
yes.
Now, in Chinese medicine, we don't do that. We don't make any separation. When we look at the qi, the flow of qi and blood in the body, we do not say that, well, the qi and the blood only flows on the brain and it doesn't flow on other
Mm.
parts of the body. We say that this qi and blood flows along the whole body, and
Mhm.
also it flows on the atmosphere in the external in the external world.
Yes,
And,
yes. This
so
is
this chi is made up of the air that we breathe,
mm, mm, mm.
the chi that we get from our parents, and the good food and water that
Yes,
we have.
yes,
So that
yes.
is the components of this chi.
So that was the what you're looking for. So that was what you're looking for in a patient and how you talk to the patients. So when you sort of made a diagnosis and then sort of make up a plan to treat. So how do you explain that to a patient?
Okay, so let's continue with the example of somebody who suffers from sciatica,
Yeah,
which in Chinese medicine is said to um, um, is a manifestation of a disruption in the flow of the qi and blood
yeah,
along the gallbladder meridian.
yeah.
So once I have made that diagnosis, then I will work out with the patient
Mhm,
what sort of therapy and measures
mhm.
I will use in
Yeah,
order to deal with the condition of
yeah.
pain on the back, headaches, and all those other pains, reflecting the derangement of the gallbladder meridian chi.
Yeah. So what you're telling them will be like, I'm going to, sticking noodles on certain
Yes.
points, and you're also going to give them a formula of herbal medicine.
No.
No.
So what I do is that um, I will work out what sort of acupuncture points that I can use
Yes.
um, to deal with that particular condition.
Yeah.
And then I will also explain to the patient why I'm actually using those points at that particular time of the day or night.
Oh, I see.
So, and this is what is called in Chinese as the system of acupuncture called 子午六入,
Oh, I see.
which
Yes.
is chrono acupuncture. That's
Yeah.
how I
Yeah.
translate it.
Yeah. Yeah.
So with this gallbladder patient, gallbladder qi derangement patient, qi derangement patient, I will choose certain points along the gallbladder meridian.
Yeah.
So one of those 2 points that I'm going to acupuncture point that I'm going to use is gallbladder 41,
Oh,
which is
okay.
on the dorsal side
Yes.
of the foot.
Yes.
So, and then I will also use a point along the triple burner meridian.
Oh, yes. Yes.
Which is called I think triple burner meridian 7, I think, which is
Yeah.
called Y Guan,
外观
Y
yes,
Guan,
yes,
and then the
yes.
other one is Su Lin Qi,
竹林
Su Lin Qi,
Oh.
and then I would tell the patient to come at a particular time during the day or night when I can actually use these 2 pairs of acupuncture points.
That actually raises another question I haven't planned. That is the timing.
The timing, yes.
Because when you say 子午流注,
Mm.
it actually is kind of if my understanding is wrong, you just tell me. My understanding is that the qi flow into different places during the different time of the day. So to get the most of the acupuncture treatment, you need to stimulate that point at the most appropriate time or most beneficial time.
Optimal time.
Optimal time.
Yes.
Yes, the most optimal time.
Yeah.
And that's when you say you ask the patient to drop in a particular
Yeah.
time. Does it also change, say, if you are according to seasons, or is only the day?
Well, this is a very interesting question about season. You see, um, that is the thing about Chinese medicine. Um, when I arrived in Australia uh, 40, 40 years ago,
Yes.
um, I found out that when it is winter here in Melbourne,
Yeah.
in Australia, it was actually summer
Yeah.
in China
Yes.
or in the US. So, and then I read from some of my classical books on TCM, like the Huang Di Neijing.
Yeah, they don't know you're going to practice in Australia.
The Yellow Emperor's classic on internal medicine. I found out that how would I how because the Yellow Emperor always says that you do everything in Chinese medicine in accordance with the flow of the season.
Yes.
So I said,
Yes.
well, what I learned in Beijing was that season is that
It's completely opposite.
winter is actually around December and then January and November. But
Yes.
when I was in Australia then, well, it was actually summer. So
Yeah.
how can I practice Chinese medicine in accordance with the flow of the season
Yes.
in the southern hemisphere? So at the time, I thought long and hard about how to do this. So I looked at those Chinese calendars that
Yes,
you
the
see on
chart, the seasonal changes. Yes.
no, it's a daily thing wherein you tear one side of the calendar once the day is over.
Yes.
I saw those calendar, and then they say that it's actually winter at that time. And then now, but I know that it is summer in Melbourne. So I thought I have to look at how I can develop
Yes.
a Chinese calendar suitable to the flow of the season in the Southern Hemisphere.
Right.
So that was in 19, I think that was in 1996, I think, when I started to um, to draw up a plan to develop a Southern Hemisphere Chinese calendar.
Wow, that's amazing.
Yes.
I remember in one of the conference you were kind of, handing out those
I
charts.
know.
Yes.
Oh, you remember that? So
Yes.
yeah, so that was it. And
Wow, that's
so
really
so
good.
now I have developed, I think, 14 or 15 editions of the Northern Hemisphere Chinese calendar and the Southern Hemisphere Chinese calendar,
Wow.
and I'm using this in um, uh, using this in the practice of chronoacupuncture
Hmm.
here in Melbourne,
Wow.
because this calendar that I'm using is based on the time zone here in Melbourne.
Oh, that's absolutely wonderful. Thank you for answering all these difficult questions. So just one more question. So to help a patient get most of your consultation, what do you do? What do you usually do? And for a patient to get most out of his consultation or her consultation, what should he or she be doing before they come to see you?
Okay, this is another very good question, because it gives me an opportunity to differentiate the practice of Chinese medicine from the practice of Western biomedicine. Um, Earlier on, I mentioned the fact that I spend around 30 minutes to 45 minutes to look after a patient in the course of the consultation and therapy of the patient. Now, aside from giving the acupuncture, I also advise the patient on how he or she can sustain the effect of the treatment and prevent having the same condition that they are suffering before they come to see me.
Mm.
So let us go back again to the case of sciatica.
Yes.
So when a patient comes with a very severe sciatic nerve pain, they really are. You can see that they really suffer a lot. It's a very painful condition.
Yes.
But the good thing is that once you give the right treatment, especially acupuncture,
Mm-hmm.
the pain can actually disappear
Oh.
immediately
Oh.
after the treatment. A patient
Right.
would come, limping,
Limping. Yeah.
and then
And
have difficulty in getting on the couch,
yes.
and then lying down on their back.
Yeah.
But after the treatment, they can actually come down from the couch and then stretch their back, and they will be free of the pain.
Wow.
Uh, but there is a problem here. Some patients, they think that having acupuncture is like taking
Taking a pill.
taking aspro or
Yes.
aspirin or
Yes.
pain-killing tablets.
Yes.
No, it doesn't work that way. So I tell them that after this treatment, and then you have to come probably for a couple of treatments. And then once the pain has subsided, I tell them to do some breathing and physical exercises.
Oh, so those exercise or the breathing was kind of specific for that particular condition. So if
Yes,
you have a different condition, your recommendation would be different.
Well, yes, because especially if a patient comes from a lower back pain extending to the leg, which is a sciatic condition,
Mm-hmm.
they have to make sure that they don't overwork
Oh, yes,
physically
yes.
their body, and then pay attention to rest.
Right, right,
But once they get out of the pain, they have to do gradually some physical and breathing exercises.
right. So
To,
the breathing exercise actually help to
of
have
course,
the
yeah,
chi
the chi to
flow.
flow, and
Right.
at the same time, it also, stretches the muscles and the tendons that has been injured as a result of well, the
Yeah,
sciatic
the condition.
the
Yeah.
condition. So they have to do the exercises and do it really gradually. I provide some breathing exercises, especially abdominal breathing, and then after doing the breathing exercises, they do some lumbar pelvic
Yeah.
exercises,
Yeah.
and then leg exercises,
Yeah.
and then ankle joint exercises.
Oh, I see. I
So
see.
so I have to demonstrate to the patient how to do the breathing and how to do the physical exercises so
Right.
that they can do it properly.
Right.
Now some patients they follow this advice,
Yeah.
but some patients
And
don't.
you do
They
you
don't.
do have that kind of
So they
patient.
come back after that. I had treated them for three or four times. They come back because they said, Dr. Ray said, I am having the same. So I asked him, did you do the exercises that I told you? Well, I'm busy with work and I'm busy with looking after our child and everything.
Yes, yes,
Okay,
yes.
so
The
okay.
excuses.
So
Uh,
I give
yes,
them the treatment again, and then explain
they
to
feel
them to do
better.
the exercise, because in most cases they forget about the exercises.
Yeah,
So I have
yeah.
to do it again and demonstrate how
Yeah.
it's actually done.
So my lesson from what you're saying is that you actually would do much better to follow the instruction given
I
by
think
your
so.
practitioner,
Yeah.
because this actually was part of the therapeutic treatment,
Yeah.
right? But most people was just taking it like a, because that's the thing in biomedicine. When you go see a general practitioner, they usually don't give you any lifestyle
Yeah.
anything
Changes. Yeah.
otherwise. You
Yeah.
just take the pill, and if it doesn't work, come back, and if it doesn't work again, and if there's any physiological change, maybe you need an operation or
Yeah.
something, you just but I think what was really good in traditional Chinese medicine is that you stimulate your own body and
Mm-hmm.
let the body do the healing.
Yeah.
I think what you
Precisely.
are doing
Yeah.
is that you actually stimulate the body by putting the acupuncture
Yeah.
point, the exercise, and you stimulate the body's self healing power.
Yeah.
And I think that's much,
It's
much
much
better.
better. Yeah.
And it saves money too.
Precisely. Saves time as well.
Yes. So my next question actually is a bit theoretical. So how do you define health in general sense? I mean, you can use the term of qi because I'm going to ask a lot of questions about qi and other flows. So how do you define it? What is health?
um, um, I see health as balance.
Yes,
It is a balance of the yin and yang energy
yes, yes,
balance in the body.
yes,
It is a balance between the patient's um, body resistance, and a balance with the all factors that brings about imbalance or illness to, to the patient. It is also a balance between the environment, external environment, and the internal environment of the particular patient. So, in essence, health is basically defined as absence of discomfort, absence of pain, easiness. Um, uh, the patient is actually at ease within himself and
Yes.
at ease with the
Good.
environment and the people around him.
Yes. Yes.
So that is how I see health.
So in traditional Chinese medicine, I actually learned the concept of 精气神, right? So 精气神 is how you feel as a healthy person. When we say someone was like energetic and really kind of in a very content mode, we would say, "Oh, 您精气十足啊." That is like saying, "Oh, you're full of energy," and they also say 神完气足, means that you have your qi intact and you have all your mental capacity intact.
Yeah.
Right?
That's a very
So that's the healthy state. So if I say I'm in a good health, I'll say 神采奕奕, means I'm like a radiant with energy and good spirit.
Yeah, in short, what you're saying is really, really good. These are the three treasures in traditional Chinese medicine: the Jing, the Qi, and the Shen.
Yes.
So a lot of the philosophers in pre-modern China, they talk about Jing Hua Qi, Qi Hua Shen, and then Shen Hua Xu. So in English, you can say that the Jing is transformed into Qi.
So the Jing basically is the nutritions, the good stuff that you take in, and also the good stuff that you stored in your body, right?
Yeah, the Jing is like the yin aspect of the body.
Yes.
Things that you see, things that's visible.
And so, for example, the blood is part of the Jing, right?
Yeah, and it is also visible. You can see the blood.
Yes.
While Qi is an invisible energy that animates the body and everything in the universe.
Yes.
And then the Shen is actually it is translated as the spirit.
But I think it's also the mental capacity, like how well you can concentrate, memory,
consciousness, and all those sort of things. It is also something that you cannot see. It is something that the Shen is something that directs everything in the universe and in the body. And there is also there's also the in that of these three, the most important, of course, is the Qi.
Yes.
It is what is summed up as a philosophy of one Qi.
Yeah.
The philosophy of one Qi sees the Qi as flowing in the triad of heaven, earth, and humanity.
Yes.
So, and then humanity and the non-human entity. So it flows through that. And that brings the whole universe together. So very important. There is a very important concept in the pre-modern tradition of philosophical tradition in China, the notion of the Qi.
Yes.
Because without the Qi, there is no life in the universe.
Yes.
Or Yudro, or space-time. There's no life in the universe. There's no life in humanity. There's no life on Earth. It's the Qi that feeds and animates all the life.
Yes. So if I go back to your early mentioning that the internal balance and the external balance, as well as the balance between the internal and the external, can we say that the Jing and Qi, well, at least the Jing is the material basis of the body, and the Qi actually was the one that linked your internal with the external because of the constant breathing, the
Yes.
exchange, right? And the shen is actually is
Mm.
your spiritual as well as cognitive connection with the
Precisely.
world, because you are talking about that someone feel at ease both with themselves as well as with the external world. Most importantly was like with other people, like interacting with other people. I mean, if someone who is healthy, they would be able to recognize other people's like cues, social cues, and they would get along reasonably well if they want to, right? If they don't want to, that's another matter. So they would be able to function normally if they are healthy. But if they are sick, I mean, I know that traditional Chinese medicine doesn't have the mind-body dichotomy. So they don't say you're suffering mental condition or physical condition. They will kind of integrate this both as one thing. So if you are sick, it's not only that you feel physically painful or tired or being sick, but also you couldn't get along or interact normally with other people and cope with the social demands or social life. So that's the mental or psychological aspect of it.
Yes, you said it right.
Thank you. Thank you. So when you say the internal and external balance would both be physical, mental, and spiritual, the three levels of harmony and balance inside and outside, right?
So you see, those who practice Qigong in China, they see the Nei Qi.
Yes.
Then there is also the Wai Qi.
Yes.
But from the perspective of the philosophy of Wan Qi, this Nei Qi and the Wai Qi are just one.
Yes. Yes. So if you keep your vital energy intact as one, then you achieve the balance.
Yes, and you also achieve the balance with nature.
Yes.
With the universe.
Yes. 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 So being healthy is not just not being sick. It's more than that.
More than that.
Oh, that's great. So that's another question. So my next question is, what do you think of the factors that cause an illness? Do you think it's all like external, like infection, trauma, poison? What do you think? I mean, from the perspective of traditional Chinese medicine.
From the perspective of traditional Chinese medicine.
Yes.
Illness is brought about by the Liu Qi or Wai Gan or Nei Shang.
Wai Gan.
Wai Gan.
Nei Shang.
Nei Shang.
Oh.
Or putting it in a classificatory system, there are external causes of diseases, and there are also internal, and then also the non-internal and non-external. Bunei Wai.
Yes.
So there's Wai Yin, Nei Yin, and Bunei Wai Yin. So the external factors of diseases is what they call the Liu Qi, the 6 meteorological factors of wind, cold, humidity, shi, dryness, and there are 5 meteorological factors of diseases.
Oh, yes, yes.
So they are collectively referred to as the 6 qi.
Yeah.
6 meteorological qi. That is, when the weather in a particular locality goes beyond the normal extent of a aspect of a weather change, like in winter, like now in Melbourne, we are going through this season of winter.
Yes.
And then what is peculiar about the coldness of winter in Melbourne now is it is very cold.
Yeah.
And also
damp.
No, there's a lot of rain.
Yeah, yeah. So the
The,
湿 was it 湿?
well, you can call it sure, but it is the same. It's, winter, in accordance with the classificatory system of the five elements, winter is also associated with the water element.
Yes, yes.
And the situation now, and probably you've heard that it was yesterday, we had an earthquake.
Oh, I haven't.
We had Dijon.
Oh,
And this is the second earthquake in a month's time
right.
here in Victoria. Now, this Dijon earthquake is associated with a lot of rain.
Oh, right, right.
So what happens is that because of several rain, you have flooding, and then you have soil erosion.
Oh, I see.
A lot of the geological formation on
Yeah,
the earth,
changes.
they
Yes.
they they they, they soften, and then they collapse, and that brings about
The
earthquake.
earthquake. Yeah.
Now the same is true with humans. A very cold winter season, if people don't look after keeping up themselves warm in winter, they can get sick.
Yes.
That's what they call, um, Wygan
Yeah,
in,
Weigan. Yeah.
in
This is
Chinese.
the exterior triggered
The
things.
受凉了.
Yeah, yeah.
You've been exposed.
To
You have
cold.
suffered from a lot of coldness or
Yes.
something like that.
Yes.
And then that affects the flow of qi
Oh, yes, yes,
on your
yes.
body, especially the lung qi.
Oh, yes, yes. The lung are supposed to be
Yeah.
quite vulnerable
Yeah.
to
So,
cold.
but people now, when this thing happens here in Melbourne, they are now saying that we have a high case of flu
Yeah,
and also COVID.
yeah, yeah.
Now, with this flu or COVID, when it becomes very cold in winter,
Mm-hmm.
like what happened in China
Yeah,
in 2019, which is actually when COVID started in Wuhan. It's not only Wuhan, and all the other places of China. Winter was very cold,
yes, yes.
and then when winter becomes very cold, people easily become so young. They
Yeah,
become
yeah,
experience an exceeding amount of coldness,
yeah,
and that disrupts the flow of the lung qi,
yeah.
and they have Wygan or common cold.
Right, right. So that's when their lung were kind of injured in a way that it interrupt the lung meridians qi flow. Is that
Yes,
how
that's
you?
happened. So when that get interrupted at the initial stage of Wygan,
Mm-hmm.
so they develop 鼻子不通,
Yeah. So
they
block the
block
nose.
nose, 咳嗽,
Yeah, coughing.
or
Yes.
or coughing, and then they sometimes they have a chill,
Yeah.
and then sometimes they have fever.
All right. They have fever.
Yeah, fire,
Yeah, fire. Yeah,
fire,
yeah,
and then those are the initial stages of Ganmao
yeah,
or a common cold.
yeah.
So in Chinese medicine, before you encounter this
Weigan. Yes.
Wygan, you not prepare yourself and prepare the people to not suffer from Wygan or a common cold.
Right.
That's the first line of defense.
Yeah,
You have to strengthen your Wei Qi,
yeah,
your protective Qi.
yeah,
You have to wear more clothes.
yeah,
You have to eat well. You have to
yeah,
sleep well,
yeah,
and not to fear because of the
yeah.
bupa.
So
Buhay.
basically, you think that what you're doing is to build up your own body's defense system.
Yes.
Well, we call them immune system.
Yeah. So in Chinese medicine, we call it building up your Wei Qi.
Yes, the defense qi.
Yeah. Which is yang.
Yes.
And then so that also your yin qi or your nutrient qi will also will also flow harmoniously in your body. So this Wei Qi and Yin Qi are interactively related.
So I'm just going to ask you, what sort of food would build up your yang qi during winter?
Well, you've heard of ginger, you know.
Yes.
The ginger. So you put some more ginger or some swan. What's this?
Onion,
garlic, and then some other.
What about meat, like a lamb meat?
Yeah, you can have a little bit of lamb,
beef.
a little bit of. I say a little bit.
Little bit.
Because,
don't do too much.
Because here in Australia, we tend to exceed all the limits of eating. So I always tell my patients to
have a little bit of it.
A little bit of that, a little bit of this, but not too much.
Yes.
The main thing in Chinese medicine is balance.
Yes.
Balance of the food, balance of the flavor of the food that you eat.
Yes.
You know, you have the pungent flavor, you have the salty flavor, you have the
bit of
sour flavor.
Yes.
And then you
sweet.
have the, bitter flavor. It has to be a combination of all those things. That is the notion of a balanced diet in Chinese medicine.
Yes. Yes.
But of course, the notion of having, have the amount of vitamins and minerals. These are also important.
Is there any particular food that we should be avoiding during the winter?
Yes. Well, you do not want to have too much cooling food.
Yes.
When it's already cold outside, you don't want to have cooling foods to have.
So what's the typical sort of, cooling food that you should have in summer but not in the winter?
Yes. Look like watermelon and everything like that, sigua and everything. You have them in summer.
Yes.
But because of refrigeration now, you can have them in.
In the winter you can have watermelon, cucumber. I think a bitter melon is something that you absolutely should avoid during the winter.
Yeah, if you look at the restaurants at the Crown.
Oh, they have it all the time.
They have it all the cold.
Oh, the other thing is the seafood. I don't think it's good to have too much seafood during the winter.
Not too much is not good.
They're cooling
it's always good to have a small amount of.
Yes, I just had a fish yesterday, so that's really bad of me.
Yeah. So the important thing is moderation.
Yes.
Moderation.
Yes.
It has to be balanced, I think, in the food, and that is true also to prevent having the cold. People will say, "How can you prevent the cold by having a balanced diet?" Well, in Chinese medicine, that's what it's all about.
Yes.
You have to have a balance of the flavors of the food that you actually have.
So you can build up your defense system in your body, and that would actually help you to not get sick.
Yeah, not get sick, not to have COVID, not to have the flu, and all those things. It's true for that.
Yeah.
But of course, you tell this to the the conventional doctor, they would say, "Well, what's the proof?" Well, so I will tell them, well, the proof is, the 2,000 years of historical records of the cases treated in China.
That's the other interesting thing about the traditional Chinese medicine. that I actually read quite a lot of what we call the EN,
Yep.
the medical
record.
case analysis.
Yes.
So basically, what in EN is that you will have a patient, the
Yes.
age, the gender,
Yeah.
the condition, the complaints, and then you have
diagnosis,
the diagnosis, the treatment,
yeah.
and sometimes you even get an analysis of the treatment. Why they do this? They will say, well, this acupuncture point deals with that,
Yeah.
and that one deals with that, and this one would modify their effects.
Yeah.
The same goes with the herbs.
And also, Professor Gao, it will also say in the the day and the year
Oh,
that
yes.
particular patient. Of course, the day and the year is written in terms of the stem and branches.
Oh, yes, the traditional calendar, the traditional way of recording dates.
What they call the Tiangan Dizi.
Yes, yes. Wow, that's so amazing. Thank you. I'm going to move on to the next question. So I'm going to now ask a question that combine both theory and practice. So it's going to be difficult. So what is your take of the yin and yang when you read like a classical Chinese medical text such as Huangdi Neijing? Because they talk a lot about the yin and yang, right? And when you're practice in your clinic, what are the manifestation of yin and yang? So you talk a lot about the yin and yang. How does it show in a body? When you talk about balance, the yin and yang, right? So we can understand the illness as imbalanced yin and yang. So how it shows up, in your clinic? What is the manifestation in illness of in terms of yin or yang? So you can talk about excessive yin, excessive yang, or imbalance of yin and yang. Yeah, let's start from the Huangdi Neijing. So what is your take of the Huangdi Neijing about yin and yang?
So we go back again to the question of sciatica.
Yes, that's a great case.
So with the sciatic nerve syndrome, or what I would refer to as the gallbladder meridian qi disharmony syndrome, well, by the nature and the manifestation of the pain, you can determine whether it's actually a yin or a yang condition. If the pain actually shift or move, that is actually a yang condition. So a patient would come and say, well, I have this pain, Dr. Rey, and it is moving on my leg.
Yeah.
So the movement itself
yes
reflects the yang condition.
So that's a yang condition if it moves.
Yeah. And then there are some patients who would say, well, I have this back pain, and it is actually alleviated by a hot pack.
Oh, so if you apply a hot pack
on it, then it becomes good.
Oh.
Well, that shows that if it works that way, then that sciatic nerve condition is a yin condition. It's a cold condition. So you can see here, if you go to a tissue therapist and you have a painful sciatic nerve condition.
Oh, they usually just give you an ice pack, no matter.
they give you ice pack.
And sometimes would that make it worse for a yin condition?
Yes, well, from the perspective of Chinese medicine, that's why it's important to know the yin and yang of things.
Yes,
if it is a yang condition, if it's a hot condition,
you will feel better.
You don't apply a hot pack.
You put an ice pack.
you if the hot, you won't apply you would apply if it's a yang condition, you would apply a yin therapeutic approach.
Right. You take a yin approach.
Yes. So, and if it is a yin condition, you would adopt a yang therapeutic approach. That is,
what do you mean the yin approach or yang
well,
approach?
like the case of if it is alleviated by warm pack,
So that actually
that
is a
is a
yang
yin condition.
approach.
That's a yin condition.
That was a yang approach to treat a yin condition. Is that what you mean?
No. If it is a yin condition, wherein
Yes.
it is alleviated by a hot pack,
But the hot pack is a yang, right?
yes. So
Yes.
you,
Yes.
you would have you are using a yang condition, a yang therapeutic approach to deal with the yin condition.
So you kind of balance
So
it out.
this is So this is where I'm referring to the tissue therapist approach. You know, you
Right,
use
right,
whatever
right.
the condition is, you use a cold a cold approach.
Yes, that was a yin method that you actually reduce the yang. But
Yes.
the patient, if it's a yang condition, it should be okay.
So what happens is that if a patient is suffering from a yang condition like pain, which is wherein the chi moves,
Yeah,
wherein
yeah.
the pain actually moves, it shifts. If you apply a cold pack, that will dampen the flow of the chi.
Oh,
And not only that dampen the flow of the chi, it will also dampen the flow of the blood
yes,
because the chi leads the flow of the blood.
yes, yes. So if you damp the qi flow or the blood flow,
Yeah.
you worsen the condition,
Yes.
right?
So the ice pack approach is a very inflexible way of dealing
Yes,
with a particular condition, which
yes.
does not differentiate the yin and yang of things.
Right, right. Wow, that's really interesting. You should tell all the GPs, don't just apply the ice pack. Think about it.
So it's important, this yin and yang approach.
So we finally get the question of qi, right? So in your clinical experience, what are the manifestation or signs of qi? So how do you detect the qi? Because you talk a lot about qi flow, right?
Yeah.
So how do you detect the qi? In pulse or in questioning, your four methods of gathering information. Where do you read of the qi, the signs or the signs about qi, and how do you treat the qi
Yeah.
in your clinical practice?
Yeah.
Give us an example. We can go back to that, condition you've been talking about.
I think I'll give an example of a patient that I treated many years ago.
Yes.
She's a woman patient, middle aged, and she came to cessation of smoking when she
Oh,
stopped
yes.
smoking. So and there's a cessation of smoking, and I think plus some lower back condition or whatever it was. Anyway, so I use certain points along the kidney and gallbladder meridian.
Yes.
And then after stimulating the needle, well, this patient told me, Ray, I said, I can feel some sensation in my back.
Yes.
So I told him, well, I said, don't be afraid.
Mm-hmm.
That is your life force.
Yes.
The life force that's coming from the kidney meridian.
Mm-hmm.
Oh, that's um, so um, so that's one example on how you used to detect the flow of qi in a particular patient. The patient would
Oh.
actually tell you what they feel.
Yes.
And basically, what you feel, a patient feels, is very important in giving any therapy in Chinese medical therapy.
Oh, I think I heard the term of 得气.
Yeah,
Means that once you put a needle in, You do a bit of slight stimulation, and yet you ask the patient, "Do you feel anything?" And they will say, "I feel numbness, or I feel
So
kind
that's it.
of a heat
Yeah.
sensation, something like that." Is that true?
Yeah, that's true. That's the qi to wait for the coming of the qi.
Yes.
The coming of the qi. Um, and but because acupuncture is very new in Australia,
Yes.
it is hard to do that compared to doing it in China.
Oh,
When I
yes.
was when I was a student in China, I was assigned during my internship to the acupuncture department
Yes.
of the of the Beijing Yuan of the
Yeah.
Peking Chinese Medical University,
Yeah.
and I saw that some of the Lao Chungi Den
Yes. Yes.
were stimulating certain points,
Yeah.
and then they would really
Oh, pretty hard. They
hard,
yes.
from the needles, and then the the patient would say, "Oh, Lila, Lila, Lila." So I said, "Oh,
The cheese coming.
okay." So and so when I came to Australia, at first year, I cannot do that
Yes.
because most people are afraid of the needles.
Yeah. Yeah. Yeah.
So
Oh, that's the other thing. If you put the needle in and they feel something, they think you might damage their nerve system or
no,
something.
they associate what I think they associate the acupuncture needle with the syringe needle because their exposure
Oh,
is to the syringe needle. And most people never had an experience of
uh,
dealing with the
needles.
acupuncture needle.
Yes.
So when I saw that, I had to explain to. That's why the consultation with that I did takes a long time. I have to explain for first timers in acupuncture
Yes.
exactly what they would feel when I put the needle. And then I would also
Oh,
explain the nature of the
yes.
acupuncture needle and how it is different from the syringe needle. So the sensation that you would feel is different from the
Oh,
syringe needle.
what is the
Well, with the
syringe
syringe
needle?
needle, with the injection needle,
Yes.
the needle is hollow inside, and then
Oh,
the
yes.
medicine flows through the hollow
Yes.
into into the vein or to the tissue.
Oh, so the needle doesn't, the less feeling you have, the better because,
Yeah,
you don't feel the pain
and
and
then
get the medicine in, right?
the injection needle also when you put it there, it tears the muscles, the muscle tissue,
Oh,
the skin tissue, and everything.
yes.
So it's painful, especially if you're having penicillin,
Oh, yes,
which is an
yes.
oil based injection.
Oh, yeah, it's pretty painful. Yes.
It's painful. Not only that, it takes a long while for the pain to dissipate because it
Yes.
takes a long while for it to be absorbed, for the penicillin to be absorbed in the body. So it's
Yeah.
painful.
Yeah.
So I explain all of these things, and then that the tip of the acupuncture needle is not actually sharp; it is roundedly sharp, a polished sharp,
Oh,
and
right.
it is shaped like the proboscis of the mosquito.
Oh, that's why you don't feel much.
Not only that, so that when you put the needle inside, it will not move. It will stay on the
Oh,
spot where you actually want it to be.
yep, yep.
But because of acupuncture is new in Australia, I don't require, the dirt sheet.
Yeah, you can't really do that.
I don't, rub the needle and everything like that because
Yeah.
the patient will shout.
We'll be freaking out.
And I find that it's actually good doing those explanations
Hmm.
and then for the patient to understand the nature of what you're actually doing and then how it differs from their normal experience with
Yes,
doctor.
yes.
You
So
see?
you actually tell patient what they would feel
Yes, but
after
what
you
can,
insert the needle. Yeah.
and with the patient that I was mentioning a while ago,
Yes.
who came for to stop smoking,
Yes.
I have given her the treatment, and then when I embed the needle on the leg, on the kidney meridian, I just put the needle on a very shallow depth,
Yeah.
and then so that she will not feel any pain. And because the patient doesn't feel any pain, so they're more relaxed.
Yes. Yes.
So it's important for the patient to be very relaxed.
Yeah.
And then later on, I invited the patient also to do abdominal breathing when they're having acupuncture, which because the breathing itself also relaxes the patient.
Yeah. Well, I also heard a story. Well, not story. I also heard the term about the qi of each organ, like you say, the liver qi,
Yeah,
the lung qi. So if suppose you are, felting, pulping,
palpitate. Yeah.
pulping a pulse, would you be able to detect the qi of the internal organ, or was
Um,
it just a myth?
no, 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 no. It's not. It's not a myth. It's a system of pulse taking that evolved for many thousands of years. You see,
Yes,
but there is even an older way um, of doing the pulse.
yes.
It is called Sanbu Jiu Ho. Um,
Yeah,
um, which is Sanbu is actually the three region
yeah,
of
of
the
the body. Yeah.
yeah, the upper, the middle, and the lower. Joho is actually the three spatiotemporal conditions, and those Joho refers to the pulse. But
So,
only this, not only the radial pulse, but also pulse on the carotid artery, on the temple, on the leg.
oh, so it's the upper pulse got
Yes,
three, the waist pulse got
yes,
three,
and
and the leg also.
that is actually in the Huangdi
Oh,
Neijing.
yes, yes, yes.
That has been forgotten.
Yeah, yeah.
So I use those other pulses when I encounter some patients because of other reasons. I could not feel the radial pulse.
Oh, sometimes they can be
So
really weak.
I
Yes.
feel the carotid
Yeah,
pulse.
yeah.
This is stronger.
So
It's
you
the same.
can detect
The,
the states
basically, the
of
flow of
the
the qi, because
yes.
in Chinese medicine, the flow of blood is led by the flow of qi.
So when you're taking a pulse, either on the neck or on the waist, what you are detecting is the qi, the state of the qi flow. Is that
Yes,
true?
or the qi, or the state of the yin and yang qi flow, because
Right.
the blood is yin and the qi is yang.
Yeah.
So
Yeah.
that's what I feel.
So when
So
you're feeling a pulse, you were detecting the yang, which is the qi flow,
yeah,
and the
yeah,
yin, that is the
yeah,
blood
yeah,
flow.
because the way I see uh, the meridian chi flow, it is actually the flow of the chi transformation
Yes.
along the meridian.
Right.
Because as you made mention about the Jing Qi Shen, these are
Yes.
the three manifestations of the transformation of the Qi.
Right. Right.
That sort
Yes.
of thing. That's how I see it. So I'm not concerned about, for example, taking the radial pulse and working out uh, the the organ
Mm-hmm.
disharmony.
Mm-hmm.
I'm
Mm-hmm.
more concerned about the yin and yang, and
Yes.
the yin and yang balance in the qi and blood flow, because we
So
do not separate
yeah.
the qi and the blood flow.
So if I can summarize it, uh, when you were seeing the patient by either asking question, feeling the pulse, listening, and smelling their, odors or whatever. These are all concentrated into detecting their qi, their blood flow, and then so that's the the whole diagnosing process.
Yeah.
And when it comes to treatment, so what you're treating is, can you also say it is the treatment to the qi and blood flow that
Well,
to
yeah,
bring in
our
the
treatment is
balance?
balancing the yin and yang qi of the
So
body.
basically, what you're treating is not a specific disease as we define in biomedicine. What you're treating is the imbalance of qi flow or
Yes,
blood
yes,
flow.
so
You want to
it's not,
bring back
yeah,
the balance,
it's not
right?
just a physical condition that I'm,
Yes,
it is the psychophysical condition that
yes,
I'm actually trying to balance,
yes.
or balancing the mind
The body,
and
yes,
body.
yes. So you're basically treating, the whole thing come down to treating the qi and blood flow.
Yep.
So if you can bring that back to balance, to a desired balanced state, then the patient should be healthy.
You're healthy. And then you have to bring the patient also to understand, those notion of yin and yang balance, because, the notion of yin and yang is very remote to
Yes,
the
yes.
understanding of a lot of
The Australian patients.
Australian patients. It's because Chinese medicine is very new here.
Yes, yes.
It is here in Victoria. It started probably 100, 200 years ago.
Right. Yes. And in China, it's been like 3,000 years, even before the recorded history. They've been doing this needle thing.
I know. And another thing is that Chinese medicine has been a marginalized discipline here in Australia.
Yes.
So
which is sad. Which is quite sad.
Yes. So that is the job of a TCM practitioner here in Australia, is to, to bring Chinese medicine from marginality or periphery to the center
Yes.
of the
Yes.
healing traditions here
Yes.
in Australia.
Yes. Like we said earlier, the traditional Chinese medicine help you to build up your body's self-healing power.
Precisely, yeah.
And that actually would be more economical and more healthier, more effective, most of the time, especially if you have to wait for a year for a surgery. Meanwhile, you can actually sort out a acupuncture to relieve your pain or something.
And that's also the reason why, because of its marginality, Chinese medicine is not covered by Medicare.
Oh, that's another thing.
Well, yeah, but that is a contemporary thing.
Yes,
because
very
it's
important.
pretty bad. But Chinese medicine practitioners here in Australia can make use of that difficult situation to bring Chinese medicine from marginality to the center. To show, how effective it can be if practiced effectively.
Yeah. One last question. My last question is about the five-phase theory, because it figured pretty prominent in the medical text. I don't really know anything about it, so I need you to explain what the five-phase theory sort of implies in terms of medical practice. Do you use five-phase theory? The water, wood, fire, metal, and earth phases, and then how do you use that?
Well,
in
actually,
clinic?
it's a very important part of the pre-modern philosophy of traditional Chinese medicine. This is the five agents, or the wuxing.
The wuxing,
the five phases, or the five elements.
Yes.
Because knowledge of the five elements is very important in the practice of Chinese medicine, because the five elements brings the environment back and into the body of the patient, or into the body of humanity.
Yes.
It is one way of integrating nature into humanity, because if you would look at nature, whatever it is, and another thing, I see five elements as this philosophy as similar to the four elements
In
theory
the Greek
on the
philosophy?
Hippo, Hippocrat, Hippocratic medicine, the Greek philosophy. It's the same.
Yeah.
It's the same. Um, uh, in the sense that it is it is one way of looking at nature and looking at the human body, and how the human body actually embodies um, the natural world outside. That's why there is no separation between the nature and humanity
Yeah.
in
So the
traditional
human
sense.
is a part of the nature world, right?
Yes, that's why they call human nature.
Yeah.
You know, the human nature and that sort of thing. And but you can also see the five elements as also as yin and yang,
Yes.
because the the fire, wood, they're actually the yang aspect,
Yeah.
and then the the um, the water and and move on to and metal.
Yeah.
It's actually the yin element,
Yeah.
and then
The earth was like a kind of
just
neutral.
the center.
Yeah, the
The
center.
center
Yeah.
it's like that.
Yeah.
So and this is also reflected in the Chinese calendar.
Yeah. Yeah. So the spring is the wood phase, and the
Yes.
summer is
So
the fire,
yes,
autumn is the metal,
precisely.
winter is the water phase,
Yeah.
and the earth sort of goes year
Yeah.
round.
Yep.
So in different elements, the the dynamics, how the change pattern would be quite different,
Yeah.
and that would be reflecting in the pulse, in how the body feels.
Precisely. Yeah.
So that's when I was reading the Huangdi Neijing,
Yeah.
the internal medicine of the Yellow Emperor, it talks about the pulse would feel different during the different
Different.
phases and different seasons.
Yeah.
Yes. So
You're right there, Professor Gao.
thank you. Thank you. Thank you so much for answering all these questions and illustrating with your clinical experience. And I'm pretty sure that my audience would love you and your experience. And hopefully, we'll do more interview in the future. So thank you. All my thanks to Dr. Ray, and let me know what you feel about our conversation, and I would certainly pass on your comments to Dr. Ray, and let's work together so that make more traditional Chinese medical service, uh, more service to be available to everyone, because it is really effective and a very economical way of treating conditions, and more importantly, we can learn a lot from Dr. Ray's experience so that we can take care of ourselves and maintain our health and have a good life. Thank you. And thanks, Dr. Ray.
Okay. Thanks for having me.